Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help you to ensure a more productive and healthy life for yourself, your families, and your employees. Now, today the conversation is on elder care. Now, to bring expert insights, we have PC Gunn, the country manager of Homage Malaysia, a leading healthcare provider in the elder care space. Now, PC, welcome to the show.
Hi, Brian. Thanks for having me.
Now, PC, give us an overview of what your company does.
So, Homage started in 2017. What we do initially was to provide home care to the elderly. So, what this means is that I think there are a lot of times, a lot of seniors prefer to age at home rather than to be in a foreign place such as a nursing home or even in to maybe have the end of life even in the hospital. So that's where we felt that there is a space where we can actually have home care for seniors. So it started off as that. Then later on, as the year progresses, and then now that we've got this pandemic, we realized that because we are the biggest supply of nurses and caregivers, what we realized also is that people such as hospitals and nursing homes are starting to look at us as a provider for this pool of resources when they need them.
I see, that's interesting. So, walk us through then how you actually do this and how you use technology to run your business.
Yeah. So I think when we first started, it was really looking at what is in this space. So there's the extremely low tech, which is a physical home where people just send their loved ones there. And then there's the extremely high tech where it's just teleconferencing. But what we aim to do is to have that in between where there is a bit of tech and there's also the offline service. So what we do is similarly like any e-hailing app, for example, we will find the nearest caregiver or the nearest nurse to the home of the loved ones so that instantly we can send the carer over to the home. And so it's within an SLA of maybe depending on the types of care, it could range up to from 3 hours SLA to about 24 hours. So that's the tech bit, matching the skill set of people around you to the requirements that you need. And then the low tech bit is really sending the physical person to care for the loved one at home, because I think that one, you cannot replace it with a robot or anything else, right?
Yes. Not at the moment. In Japan, you do have caregiving robots, but that's a different thing altogether. But so PC, you are a platform business only, or do you also physically provide the services as well?
So okay, let me put it this way. So from a consumer perspective, if I need, let's say, for example, a caregiver, even a therapist, what I'll do is that I will just put up at what time, where, and the profile of these loved ones. So because the thing is that we need to make sure that the carer that we send across is able to handle this loved one. So say, for example, if a 80 kg senior,
Okay.
I cannot have someone a small size as me to help, right? Because if there's a transfer needed, I probably need someone a slightly bigger size to be able to handle the weight of these loved ones.
Okay.
So that's that perspective of the loved ones that we are caring for. Then the other segment that we are caring for is also children, especially if, let's say, for example, if they're not in the country, they can still book that appointment and still get a live feed as to what is happening during that visit when our carer is taking care of the loved ones.
Okay.
So that's the second stakeholder. Now, the third stakeholder that we are serving is really it's a gig economy, right? So for care professionals such as caregivers, nurses, or even retired nurses, the thing is that retirement age does not mean that you just sit at home and not do anything. You can still give back. So it becomes a platform for you to apply for jobs to people near you. So you don't need to travel far to just earn, right?
Yes. No, so can I ask you then? So essentially, as you said, you're the Uber or Grab of the caregiver space. But what sort of numbers do you have in your platform at the moment?
So in terms of application, we do have, I think on a monthly basis, we do have close to 10,000 coming in, but we are very strict in terms of who we approve, purely because we are looking at seniors, that's one. And also the thing is that this is quality care that we are looking at. So it's not just anyone that we will approve. So from the entire funnel, we approve close to about 10% thereabouts, sometimes even lesser. So right now in our pool, we have got close to 2,005 across Peninsula Malaysia.
Okay, so 2,500. And so in terms of people getting care, how many do you have every month that actually receive service?
So I think because we are in the major states of Malaysia, Peninsula Malaysia, like
Right.
Klang Valley, Johor, and also Penang, on a monthly basis, we serve close to about 2,000, 2,200 homes.
Okay.
Yeah.
All right. And what's your business model like? How do you make money?
So we do I'll start off with the consumer. So how we charge the consumers is uh, pay as you go. You only pay when you need them. So a lot of times people will compare it with domestic helpers example, but that's where I come to you and say that, would you really put the trust of your loved one to a domestic helper, but you're already paying a fixed cost, say for example, like 1,005. So we're talking about a monthly fixed cost versus the quality, and you only pay when you need them. So
Yes.
meaning, for example, if a hygiene care which requires manual transfer, this one probably you only need 1 hour a day. So we only charge you per hour. So that's our business model for consumers. So now with what we do with our organization, so say for example, like hospitals or even nursing homes. So hospitals, we know that they come to us when there's shortage of staff. So say for example, during this pandemic, where their nurses are being called to do, say for example, the swabs or even a vaccine, but their own hospitals actually need resources. So we always work out in a way that you only call us when you need this. So it could be like a daily rate, or it could also be like a 3 months, okay, just provide me nurses in ICU care, for example, or even somebody who is doing the administrative work. So we also supply that. So at the end of the day, we will take down your requirements, because I cannot be charging you for someone who is working in an operating theater compared to somebody who is working administrative. So a lot of these models, it's really based on requirements. It could go up to hourly rate, day rates, or even monthly rates.
Okay. So how for typically for a consumer side of the business, what is the hourly rates like?
So we go by, if it's an ad hoc, it will start off at 40 ringgit. But
Okay.
if you know this is a long-term care, it goes as low as 29 ringgit.
Okay.
But again, I will emphasize on this block of hours that consumers are purchasing. You only use it when you need them. So it's almost like a credit-based kind of model.
Okay. So then on the side of caregiver itself, how much do you charge the caregiver?
So because of what we do, and a lot of times, like I said earlier, I serve also the other stakeholders.
Right.
70% of the cut actually goes to the caregivers, the professionals themselves.
So you take a 30% commission.
Yeah.
Okay. And obviously what this does is this gives caregivers just like the gig economy from the ride hailing business, it gives people flexibility. It also gives people the opportunity, some people to earn more money than they've earned
Abs-
before. So
Absolutely.
can I ask you, so how have your services helped to bridge the gap with the elderly, especially because of the pandemic?
Mm. Uh, maybe I'll start off with the gig economy first. I think during this pandemic, there are also a lot of people who are retrenched. So a lot of them, they are also out there. So there are also different skill sets that we realize could work. So say, for example, if some people actually have got the calling to serve, we will put them under, say, for example, if they can be groomed to take care of demented patients, so, for example. So what we will do is that we'll make sure that they go through the entire syllabus of dementia and Alzheimer's. This is together, we curate the syllabus with our partners and to make sure that they are all equipped to take care of seniors of different stages of dementia, example.
How do you do that? Is that a physical class or do you have some online classes? How do you do that?
We used to have physical classes, but now, very unfortunate, we have to resort to Zoom or even Google Hangout. But having said that, we are not putting in the new caregivers into the pool as of now because we already have those qualified caregivers who are already qualified to do dementia patients. So then we will only push that through. So now the ones who are fairly new at this, say for example, we just pushed out vaccine escort because a lot of times, although, say for example, we are working from home, but we don't know how long the vaccine will take, right? Some could go up to 45 minutes, some could go as long as 3 hours. So what we do is that we provide vaccine escort for seniors, example, during this pandemic. And then we match it with probably a somewhat a less experienced caregiver, but they are able to do the escorting
Right.
during this pandemic. So that's that matching of the skill set. But now coming back to seniors at home, so of course then we have got seniors who are immobile, example. So all of this is a lot easier when it's done at home. What we do is also, because right now a lot of them they cannot travel out, or if it's within the 10 km vicinity, what we will do is we will also buy these consumables as well. So we equip the family to be able to do caregiving at home.
Okay. Now, let's zoom out a little bit and take a macro look at the industry itself. Now, one of the key trends to note is Malaysia is an aging population. So is Singapore. And in fact, in Malaysia, 30% of the population will be above 60 by 2030, if I'm not mistaken. Now, what is your view on this, the state of the overall elder care sector in Malaysia?
Um, so I feel that there are not enough options for seniors in Malaysia. So say for example, I take myself as an example. If I were to look at 40 years down the road, what are the options out there for me? And I don't have children and I don't intend to have children. So what does this mean? Do I have somebody to take care of me then? Um, do I go to a retirement village, which is still somewhat new right now? Do I don't want to be in a nursing home because I think that space there, it still needs a little bit more work. But if let's say, for example, somebody who is like me, I'm fortunate enough to stay in a house where it's inherited. But this home is probably not equipped for me to grow old because it's double story. There's steps. So there's a lot more investment I need to put in place to make sure that I can age well at home.
Right.
So that's the planning bit that we don't think about in advance. Um, so that's for people, maybe our generation. But for seniors, I feel there are a lot of times that they are also reliant on their children to provide the care. So we call these the children themselves as sandwich generation, where I already have my own family to take care of, but there's also this filial piety that I need to pay back, and to provide for my parents. So now what does this mean? So I'm torn between the two, and that's where there's this whole caregiver burnout. And at the end of the day, I think our loved ones, our parents, don't want us to be torn. And a lot of times, they themselves are left with no options if they are not financially prepared. So I think the financial aspect of things is something that we need to overcome.
Also, one of the key things is the fact, and you're right, because we talk about the elder care, we tend to think about old folks' homes, and there's a plethora of different options and different price points. Some of them are not, as someone I know said who has been in a old folks' home, you're basically just being sent there to die, and that's really how he felt. But in your space, in terms of your digital app-based caregiving and on-demand caregiving, who else do you see as your major competition?
Um, I think, like I've mentioned earlier on, I don't really look at it as competition right now because there's just not enough options for people to grow old. So, say for example, initially when I first got into Homage, I always thought that okay, maybe my competition is the nursing home or even old folks' home. But actually, it's so wrong to say that because at the end of the day, we are serving the seniors, this aging community. And for example, if somebody, so we do have people who send their parents to nursing homes, example, because they're just not at home to take care of them. Or example, their homes is just not big enough to take care of their parents. So to me,
Yes.
is that if that facility gives you that option, please by all means send your parents to nursing homes because there's a big difference between old folks home, nursing home with retirement village, right? But at the end of the day, it's for us to still provide care. So to answer that question of competition, I don't think it's a competition because at the end of the day, we as children, we owe it to our parents to give them that that comfortable living, just aging with pride, with that dignity that they have left.
And PC, there's one of the key things is I think in the past, because we didn't have on-demand professional caregiving, especially in difficult situations like, for example, elderly parents who have Alzheimer's, Parkinson's, the stress on the caregiver is tremendous. So whether it's, and I can speak from personal experience because I have an aunt who had to go through that for 17 years. And the stress of that is tremendous. So if you can't handle it, you outsource it and you put it. If you can afford it, obviously you have a combination of a family caregiver plus a domestic helper or so forth, and it's still a very difficult task. So if you have an on-demand professional caregiver option, that really makes it much easier for the family to keep the elderly person at home, which is where they really would ideally like to be. Now, can I take a different approach and ask you about the whole professional caregiver industry? So obviously, by your market entry, you've opened up options for caregivers. Like you said, it's a gig economy thing now. You can choose to work, you can choose not to work. What are the challenges that they are facing right now?
So I think you're quite spot on. So I'll just circle back to earlier on you were talking about Alzheimer's or even dementia. I think one of the challenges is really to equip our caregivers with this sort of medical knowledge. So just give you a bit of stats, right? So 85% of our caregiving hours is actually on non-medical professionals, meaning we're talking about caregivers. So 15% of them are really nursing care. So if I take a look at this 85% pool, are they equipped to take care of seniors? So say, for example, if we talk about dementia, I think a lot of times people may think that, oh, maybe, this loved one is just being forgetful. So I think there's a lot of classification of symptoms that they are unaware of. So that's the first one. And then it gets people very impatient. And I think that's where the relationship with the loved one breaks down. Often the challenge that we have is one, the caregiver coming in with the right set of skills. That's one. The second piece, which we find it's a little bit challenging as well, is that because we have the close rapport with the seniors, a lot of times the senior shares things with our care professionals. So in the end, we become the bridge to this relationship. But ultimately, what we want is to foster that bond as well. So that's that. And then the last one is more of sustainability of this care, because it's a gig economy. But if let's say somebody who is demented, I cannot be having multiple caregivers coming into the homes, because to that care recipient, they'll be like, who are you? And then the next day you send me somebody else. So I think the other challenge that we have is to make sure that we provide consistency in terms of the familiarity.
So PC, how does that then work? Because if you are billing as a platform, yes, okay, the first time I make a booking, the caregiver comes in 3 or 4 times. Then after that, isn't there an option to disintermediate you and basically do a side deal with the caregiver?
Wow, Brian, yeah, that's spot on. We do have many cases like this, but I think at the end of the day, it's quite difficult to find a good match. So if the family do find that this is a good match, and if it's good for this senior, I think for us is by all means go ahead. So I think it's a very different business. So it's like the love and the caregiving. So this part here is very hard to measure, like, oh, what's my attrition like, what's my retention customer. So to us, it's more of, if this is the right fit, yes, please go ahead. But what we do tell the family is that we do have also a pool. So should this person be unavailable, that we are always around anyway.
Okay. And what do you think that the private and public sector could do to provide frontliners with more sustainable career prospects? Because I think I see that as a big opportunity here to give people, as you said, options. Now, on the caregiver side and the frontliner, nurse, matron, or so forth, suddenly there's a different career path.
So let me just also paint a landscape for you, Brian. Is that I think 2 years ago, a 10 years experienced nurse can earn up to, I don't know, 3,000 ringgit.
Okay.
Yeah, so, and this is all purely based on the people whom we have interviewed, and they are highly skilled, right? What we don't understand is, why you've got this vast experience, how come you're only commanding 3,000 over ringgit? I fast forward it to today. Today, right now, we need swabbers, we need vaccine nurses, and our government is trying to reach herd immunity as fast as possible. And the people with this sort of skill sets are the nurses. Within the last 3-4 months, suddenly these nurses who were earning 3,000 over ringgit, they can command up to 6,000 ringgit, 10,000 ringgit even in this period of time.
Okay.
So I think ultimately for me is that pandemic, I really hope only happens in somebody's lifetime, only once. It's an opportunity. So it's an opportunity for nurses to actually make a stand, because right after we reach herd immunity, it's a question of, can they command this kind of salary thereafter? Because we're talking only about 6 months that you're earning 6K, example. What's going to happen after that?
But I think, PC, one of the things that may happen is also this. The demographic trends are in their favor. So in other words, home care, as opposed to elder care in a home, will probably take more and more of a priority, because as you said, from a filial piety standpoint, I much rather have my parents close to me and a professional coming in and looking after. I don't have to send to the home, even though I'm not equipped to handle it. because that is often the case. So what may happen then, just like the gig economy, so to use an example of, and we've had Food Panda on one of our previous shows, the Mat Rempet or so forth who used to earn 1,000+ ringgit maybe as a dispatch boy now can earn a minimum of 3 to 5,000 ringgit, some as much as 10,000 ringgit.
Yep.
So what it does is it's empowered people to earn differently. So people want to work harder, earn more money. You want to earn less and still make your 3,000, but you can still work a third of the time to earn that 3,000. So perhaps that's the way that post-pandemic the world will look like. But for the patient, it will be a better thing. For the family of the patient, it's probably a better option because there's better trained people. And for the gig economy, now the new gig economy medical person, that's probably a big advantage as well.
Yeah, absolutely. So the second part to that question was that even before we hit MCO, our caregivers, so just caregivers, earns up to 8,000 ringgit, and she doesn't even work like 24/7 or even like 12 hours, 7 days a week. She probably just needs to work 5 days. I think an average of about maybe 8 or less hours, she can earn up to 8,000 ringgit. And that to me is a source of income, and it's at your own flexibility. And we're talking about caregivers. So what more nurses? So I think it's the same thing as this now opens an option for you to look at, okay, after this pandemic, if this is going to be a place where you're going to be earning so much, which offers you flexibility, this then means that not just young professionals, but even retirees can also opt for this and still earn a decent living.
Yes, and there's precedence for that, because if you don't have to look very far. You look at the caregiving industry in Australia, and that's probably the trend line that we would go to. Basically, it's an alternate career for not only to earn money. So as a caregiver, you want to make a difference in society. You want to help older people, and that's a way of doing it.
Yeah, I think earlier on I was sharing with you the stats, right? So like 85% of our caregiving hours is non-medical. So these are the areas that hospitals or organizations cannot even cover. So most of them, it still comes back to home. So, and that's where the whole caregivers come in, because they are non-medic. And there's shortage of supply right now for caregivers still. So I think people should look at it from a very different angle, that this is not just a job that nobody else wants to do, but I think there's a higher purpose in doing this.
A final question now. What are the plans for Homage moving forward? Are you going to roll out new services? What's the strategy? And what's the target for growth?
I think for Homage as a group, we are now in Malaysia, Singapore, and Australia. We're planning to go to C4, C5 country in the next coming years. But I think particularly for Malaysia, I think for us is that I want to bridge the accessibility to healthcare. That's one. And then the second thing is financial aid as well. So I think this is where I really urge for companies like insurance or even our government to start looking into better subsidies for young generation, so that it's not really entirely on us. That's one. And then the third thing is really on pre-planning. Like, what are the things that we are doing for pre-planning, just so that we don't hit at 65 and then we start thinking, oh dear, I don't have enough funds, I don't have enough coverage. So I think we are still in the education phase right now. So for Malaysia, there's just so much that we can do in terms of financial and healthcare accessibility. So those are the two things that I really want to work with the players in the market.
Now, PC, thank you very much for taking the time to be on the show.
Pleasure is mine. Thank you for having me, Brian.
Now, I'm Brian Fernandez. I've been speaking to PC Dunn, Country Manager of Homage Malaysia, on Biztech Health and Wellness Show. Please view our website as well as our Facebook and LinkedIn sites uh, at www.biztech.asia for business and technology conversations. Thanks a lot for tuning in.